Human beings have long recognized that certain diseases are hereditary. In recent years, scientists have begun to identify particular gene mutations responsible for some of these diseases. BRCA1 and BRCA2 belong to a class of genes known as tumor suppressors that prevent the growth of cancer cells. Mutations of these genes have been linked to hereditary breast and ovarian cancer. Dr. Wendy Rubenstein, director of the Genetic Testing Registry at the National Institute of Health, explains.
BRCA1 and BRCA2 are two different genes. They were named for the breast, BRCA, gene number 1 and number 2, a little bit misnamed because they also cause ovarian cancer. We all carry 2 copies of each one of these genes. So, for example, one BRCA1 gene from our father and one from our mother, and then we can pass them randomly to our children. There are a lot of implications from that, and one is that you can inherit the risk of cancer from either side of the family, from either parent. It can actually come from fathers as well as mothers.
It is important to note that only 5 to 10% of breast and ovarian cancers are hereditary. Most breast cancers are sporadic and develop due to a combination of other genetic and environmental factors. In addition, not every BRCA-positive woman will develop breast or ovarian cancer in her lifetime. But every BRCA-positive woman has a greatly increased risk of developing these diseases.
There'd been a lot of cancer in my family, and my mother and my cousin were recently diagnosed. My doctor recommended that I have genetic counseling and genetic testing for mutations in the BRCA genes. When the results came back, she told me I was positive and that my risk of developing breast and ovarian cancer was drastically increased in comparison to other women.
While the average U.S. woman has a 12.5% chance of contracting breast cancer before the age of 70, a BRCA-positive woman has a 40 to 87% chance of getting the disease.
Over a woman's lifetime, the risk of ovarian cancer is only 1 in 70, or about 1% by age 70. But when you look at those who have a mutation in the BRCA1 or BRCA2 gene, we're looking at a 27 to 44% risk of ovarian cancer.
How prevalent is the BRCA gene mutation?
In general, in most populations, the risk is about 1 in 500 people walking around may have a BRCA1 or 2 mutation. It varies in different populations, but in Ashkenazi Jews, there's about a 1 in 40 chance of carrying a mutation in one of the 2 genes.
Fortunately, women who are BRCA carriers have options to significantly reduce their risk of developing breast and ovarian cancer.
Firstly, women can engage in diligent breast surveillance. The goal of surveillance is to detect the disease in its early stages when effective treatment is possible. The current standard advises that the average woman have an annual mammogram from the age of 40. However, if a woman is BRCA positive, breast screening should begin at age 25. She should have 2 tests per year, a mammogram and a breast MRI, both accompanied by a clinical exam. A second option is chemoprevention, which involves taking certain drugs. For postmenopausal women, the drug tamoxifen can reduce the risk of breast cancer by as much as 50%. A third option involves removal of the breasts.
Prophylactic mastectomy is an option for breast cancer prevention in women who have a mutation in BRCA1 and BRCA2. This has been shown to be up to a 95% protection against breast cancer.
For ovarian cancer, surveillance methods include pelvic exams, transcervical ultrasounds, and blood tests, though unfortunately these have not proven very effective in detecting ovarian cancer in its early stages. Another option for someone who is BRCA positive is an oophorectomy, which involves the removal of the ovaries and fallopian tubes. A woman can have an oophorectomy once she has finished having children in her late 30s. Even with BRCA, it is less common to develop ovarian cancer before this age. This brings us to the questions that we will address in this class from a Jewish legal perspective. How far must a healthy individual go in order to avoid dangerous outcomes? If a woman were BRCA positive, would any prophylactic measures be considered obligatory in order to avoid the risk of premature death? If yes, would Jewish law oblige women to test and determine if they are BRCA positive so that they can know if they need to engage in prophylactic measures?